Hi, I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And our topic today is a client with what appears to be a downslip pattern of the right hemipelvis. And downslip is described as a sacroiliac joint dysfunction, but we don't know if that happens inside the joint or if it's an outside of the joint phenomenon, such as involving muscles that are guarding with some muscles being inhibited. There's no research on validating that downslip is a valid construct in which the ilium slides down in relationship to the sacrum and becomes stuck. There's no objective research to that. So I present this in general terms, and I present it, I demonstrate the change in motion in the pelvis and the change in ligamentous tone of the lower sacroiliac ligaments. And anyway, there's all kinds of debate as to whether or not it's a valid phenomenon in the joint or outside of the joint. And we don't have the research to guide us either direction. I'm more interested in solving problems. And so I'm going to let our client, Evan, describe his problem, and then I'll demonstrate to you the clinical findings. So Evan is a 24-year-old physical therapist and a triathlete. And go ahead and tell us your story.
Sure, yeah. So I was actually working on a patient and doing a technique where they were applying pressure to with their leg. Probably should have had their leg a little lower on mine, but they were actually up kind of on my pelvis. And I was just having them push into me with their leg, and I felt a shift. And not so much pain, but definitely felt a shift and had some discomfort the next day. And
where did you feel the shift?
It's hard. It happened very quick, but I felt it on the left side, and that's
in
the
region
side
of your
affected.
sacroiliac joint.
Yeah, kind of in this SI joint.
Sure.
And so the next couple days, the next day again felt kind of out of place, or just it felt wrong but not super painful, and then I ran a 10K race on it 2 days later, I believe, and about a quarter of the way through the race or halfway through the race I started to have pretty bad pain in the SI joint itself and just the surrounding musculature. So the following week was having trouble even walking and treating patients, so I totally took off from any physical exercise or activity, and had some coworkers assess, and we thought it was a posterior rotation or some form of that, and so I was doing muscle energy techniques to try and use the hip flexor to correct that and rotate the left hemipelvis anterior. Didn't really have much luck with that at all. Went to a chiropractor just to get kind of a manipulation. Had a coworker perform some mobilizations on my hip and just wasn't really seeing much improvement. The muscles calmed down around the area, and I got to a point where it was starting to feel a little bit better, but still I was having pain right in the SI joint itself. And so I tried running again a couple weeks later because I just thought it was sort of starting to heal, and about 3 minutes into the run it was back to square one. I was having a lot of pain with it, and just a lot of discomfort, which the next week had kind of that same feeling again. So just been having those symptoms. I'm at the point now where the muscles are calmed down, but that pain in the joint is still pretty present, with hip extension, with forward flexion, with a lot of different movements throughout the day.
And especially running, right?
Yeah, I haven't even tried running since that last time because it was just boom, it just set me back quite a bit. So
okay. And how many physical therapy adjustments did you get? How many chiropractic visits and how many massage?
Right, so the physical therapy treatment wasn't super structured because I'm a physical therapist and I had coworkers. It was more just, over lunch.
Yeah.
Okay, can you take a look at me?
Sure
How's
thing.
it looking today? How's the leg length discrepancy looking? So it was I was just kind of doing some of those muscle energy techniques myself. I probably had 4 or 5 chiropractor adjustments, which did give me some relief. They said it was not moving. The left hemipelvis was really stuck. They did mobilizations, and I'd say it made it feel a little bit better, but I knew it wasn't correcting the problem. So I did have a massage I went to a sports masseuse last week who really just targeted the muscles around the hip, which seemed to help calm down the muscles and everything. But again, still having that pain
Sure.
in the SI joint.
Sure. Alrighty. So let's take a look at you. Let's have you lie on your back.
Okay.
And I did a back eval a while ago, but I'm just going to show some of the main findings. He does present with asymmetry, and you can come a little closer. I don't know if you'll be able to capture that or not, but his pelvis is asymmetrical from side to side, and it looks like what they name a left posterior ilium. So his PSIS is posterior and superior on the left, and the anterior iliac shelf is higher on the left side. Let me do passive spring testing, so I can load and I can induce posterior rotational force through the whole pelvis on the right side, and on the left side it's blocked. I cannot take up the slack. I'm putting a reasonable amount of force. I'm applying even more force than usual, and it just feels stuck. There's no yield. Let's have you lie on your stomach, please. Now you have that same appearance as though you have a left posterior ilium, or coupled with a right anterior on the right, with the left posterior iliac shelf being more inferior. And I think the camera can capture that. Can you see that through the lens? That this left one is lower? And then if we come underneath the ischial tuberosities, the left ischial tuberosity is inferior. Now I'm going to do an anterior rotational spring test, but I can't even take up the slack. Again, that's stuck. With a reasonable amount of force, I cannot take up the slack because it's already taken up. And so I'm not able to induce passive mobility. On the right hemipelvis, you can see that I can take up the slack. I can push it to a natural end point of movement. And then I'm going to do a spring test. So now I'm going to thrust it, and you can see it goes a little further forward and it bounces right back. And that's a normal physiological response on the right side. Now on the right side, I can take up the slack superiorly through the sit bone, and I can spring it. And I spring his whole body. I see his head bob up and down. So the force translates through the SI joint and all the way up through the rest of the body. And on the left side, it's very restricted. I'm using a moderate amount of force, more than typical, and there's no give at all. Now I'm going to do an inferior spring on the right side, and I can see his feet bob up and down. Maybe you can shoot the camera to the feet there. So you can see that force translates through the pelvis, through the SI joint, through the hip, down to the lower extremity. And on the left side, it's so rigid, I'm not able to take up the slack, and this is probably twice the average amount of force that I usually use, twice the force I used on the right side, and there's no give there. So we have blocked mobility. The other thing that we have, the sacrotuberous ligament is down here connecting the ILA of the sacrum to the medial aspect of the ischial tuberosity. So if I come obliquely here, I can feel that ropey ligament, and I can indent that ligament just a little bit, and that's normal. That's a normal finding. On the left side, it's more prominent, okay, and it's very tight. It feels more like bone, and I'm not able to indent that ligament. So he has what we name downslip of the left ilium, and we already talked about the controversy of that diagnosis, but nonetheless, I'm going to treat it from a biomechanical perspective. But before I do that, and we certainly will refilm the response to treatment, I want to show you how that inhibits muscle function. So if you could extend this right hip, please, and then hold it. Don't let me push it down. Ready? 1, 2, 3. So he's very strong. And let's do the same thing here. 1, 2, 3. So he's got some muscle inhibition of his extensors. Can you lie on your back? I didn't hurt you, did I?
A little painful, but...
Because you made a little sound that concerned me. Sorry.
No, you're good.
All right. Lift this leg up. And then to the count of 3. Ready? 1, 2, 3, go. Okay. And this one. To the count of 3. 1, 2, 3. And it finally gives, okay? So that's interesting. You were stronger on the left one before.
No, left was weaker.
Left was weak.
Yeah,
left
that's
was
the
weak.
side it's on.
Okay, so let's do it one more time on the right. 1, 2, 3, go. You're pulling in everything. Good, and do this side one more time. 1, 2, 3, and yes. Alrighty. So that's consistent with what we found earlier. So we'll stop filming here, and I'm going to treat him, but I'll explain my treatment. What I'm going to do is look for the angle in which I can gain some superior mobility through the hemipelvis. So if I push up through his leg right now, it feels like I'm pushing against a brick wall. Okay? If I come into abduction a little bit, feels the same way. All right? Typically, in a moderate amount of adduction, we get some movement. And can you film the body? Can you show that this force translates up the leg into the pelvis? I can even see his arm bob up and down. I can see his head bob up and down. So this is the direction of treatment. And I'm simply going to take up the slack and push on this for 5 minutes. And I will also teach him self-treatment for the downslip pattern. So we'll stop filming now. Thank you.